Hello, my name is Jackson Carlson from Team 19, and today I'll be doing our PsychBusters project. The first myth we will discuss today is the claim that you cannot die from a lack of sleep. While it may be true that you won't die directly from a lack of sleep, sleep deprivation can cause a multitude of other of other psychological and physical issues in one's body. According to Columbia University's Department of Psychology, sleep deprivation has been linked to both higher levels of psychological distress, including anxiety and depression. The National Institute of Mental Health defines anxiety as a mental disorder characterized by excessive apprehensiveness about real or perceived threats and stressors, typically leading to avoidance behaviors and often to physical symptoms such as fatigue and unexplained body pain. The Institute defines depression as a serious mood disorder that can affect how both a person feels and how their body works in negative ways. For people who are suffering from psychological disorders such as anxiety and depression, lack of sleep acts both as a cause for higher levels of these disorders as well as an effect from suffering under them. According to Johns Hopkins Medicine, those who have depression and anxiety often focus on what is seen as minute stressors by others, which can affect their mood and sleep cycles, as overthinking can cause one to be unable to relax, leading to a lack of sleep. This in turn can cause fatigue and body pain, as mentioned before, as well as more chronic health issues such as heart disease, kidney disease, high blood pressure, and diabetes. Chronic health problems such as these can lead to the worsening of one's quality of life without treatment, and in worst case scenarios, death. Along with this, sleep deprivation has been shown to be linked to an increase in suicidal thoughts among those diagnosed with depression. According to the National Library of Medicine, individuals with depression often experience disrupted sleep patterns, such as insomnia or reduced sleep quality, which has been proven to intensify feelings of hopelessness and emotional instability. Sleep deprivation impacts the way our brains function by disrupting the regulation of our emotions, which enhances negative thinking, a key contributor to suicidal ideation. It disrupts the balance of our neurotransmitters, which are essential for mood regulation, causing an increased vulnerability to suicidal thoughts in individuals with depression. In conclusion, while it may not be entirely accurate to claim that one can die solely from a lack of sleep, the effects of chronic sleep deprivation are severe and multifaceted, impacting both mental and physical health. A lack of sleep is strongly associated with physical or psychological disorders like anxiety and depression, which exacerbate symptoms and create a cycle of increased stress and sleep disturbance. This cycle not only affects emotional well-being, but also leads to physical issues such as fatigue, chronic pain, and heightened risk of conditions like heart disease, high blood pressure, and diabetes. For individuals with depression, sleep deprivation can worsen symptoms, even increasing the risk of suicidal thoughts. Therefore, prioritizing adequate sleep is essential for maintaining mental health, physical well-being, and the overall quality of life of one's of someone. This shows the importance of addressing sleep as a critical component of having both a healthy body and being a therapeutic treatment for psychological disorders. The second myth we'll be discussing is feeling no pain would be an advantage in life. Feeling no pain to some may seem like an advantage and a blessing, while others who have a rare condition say it's a curse. The inability to feel pain, also known as congenital insensitivity to pain, otherwise known as CIP, is a genetic disorder caused by a defective gene that affects the normal development of sensory and autonomic nerves. Stephen Betts was an individual diagnosed with congenital insensitivity to pain at the age of 5 years old and went through a lot of hardships because of this condition. At a young age, Stephen was constantly getting hurt. He bit the tip of his tongue off, most likely due to not feeling it and realizing that he was biting it off. And he also fractured the right metatarsal in his foot because he jumped down a flight of stairs with no pain. As a child, you have no consequences for doing something you're not supposed to. As a child, you fall down, get hurt, learn from your mistakes, and because you got hurt, you try your best to avoid the mistakes and the objects that cause you to get hurt. For example, my younger cousin would be scared to go up and down the stairs and would hold someone's hand to avoid falling. This isn't the case for someone suffering from CIP, as they aren't afraid of getting hurt, so they do so as they please, resulting in serious injury and without even knowing it, which could lead to death or other serious injuries. Most people with CIP end up passing away at a young age due to the inability to feel pain. You could have internal bleeding, a burst appendix, a broken leg, ankle, wrist, or arm, but without knowing because you lack the warning in your body, which is pain. It could cause serious damage and lead to death. Unfortunately, this condition has no cure, but there are ways to prevent further injuries and even a way to help those who feel pain. To prevent further injuries, set up precautions around the house such as soft edging the corners on tables and other sharp objects, notifying a teacher at school about your child's condition, and having good hygiene to prevent infections. Other than this, there's also a way for those who have CIP to feel pain, which is a drug called naloxone. Naloxone is a synthetic drug that blocks opiate receptors in the nervous system. Having this helps people with CIP realize that they aren't invincible and that they can get hurt. This could be a good way to possibly treat CIP in the future, but there is still more research to be done. To better understand why being unable to feel pain offers major risks, we need to know how pain neurotransmitters act. Pain is delivered to the brain via certain nerve pathways when the body meets damaging stimuli. Nociceptors are specialized pain receptors that detect tissue damage and stimulate nerve cells to release neurotransmitters such as substance P and glutamate. These molecules then send a special message up to the spinal cord to the brain, where they are interpreted as pain, encouraging us to respond fast to prevent any additional harm. People with CIP do not have proper pain pathways, thus signals that would ordinarily warn of injury never reach the brain. Individuals with CIP are blind to injuries because they lack these signals, putting themselves at higher risk for severe health issues that can be prevented if pain served as a natural warning system. In conclusion, the myth that living without pain is an advantage ignores how important pain plays in our survival. Pain signals us as an impending risk and allows us to take action to avoid further injury. For patients with CIP, being unable to feel pain increases the risk of life-threatening injuries and consequences. While there are preventative measures and therapies that can be beneficial, it is not an easy cure to protect the function of pain in our bodies. Lastly, pain can be unpleasant, but it is necessary for a safe and healthy life. Thank you.